Welcome back to AM Northwest. You know, for some people, surgery can be the best option when dealing with serious weight issues. And here to share her personal story of weight loss, we're happy to welcome Rachel Fishman, and from Oregon Weight Loss Surgery, Dr. Emma Patterson. Thanks, guys, for being here. Rachel, let me start with you first. Talk about the lap band surgery and why you chose that.
I had been struggling with my weight for a while, about 12 years, and the lap band surgery with my age, and I felt like it was the right surgery for me. It was less scary than some of the other surgeries, and after going to seminars and listening to the options, it just seemed like the best option.
You struggled with this. How much weight did you want to lose?
About 100 pounds.
Yeah, and I know you've done that.
Yes.
And you tried other options, I'm sure.
Lots of options, lots of yo-yo dieting, losing a lot of weight, gaining it back, trying to lose weight and not being successful.
And here's a picture of you, and this is obviously before.
Yes.
And unbelievable, the transformation. You look great. Doctor, I imagine you hear this story a lot. I've tried this diet, I've tried that diet, I've tried these pills, I've done that. How does lap band work, and why is it so successful?
You know, the lap band and other types of bariatric surgery, I think, work because they make people less hungry. You know, when you're going to diet and lose weight without surgery, the body naturally makes you more hungry, and it's really hard to not eat when you're hungry. So the way the band works is a little silicone ring, and this is a little model of the stomach here. The band goes on the very upper part of the stomach. There's a little tubing that connects to an access port that I sew under the skin but on the muscle, and can inject saline in this port in a little brief office visit. The saline travels along the tubing and then inflates this little balloon here and squeezes on the stomach. And that squeeze controls how much someone can eat, so they have to eat slowly and chew well. But also it helps control their hunger, so then when they lose weight, they're not ravenously hungry.
Does it make them feel full? Is that
yeah,
the
so
idea?
they feel full on a small amount of food and aren't hungry for several hours.
Is the lap band permanent?
It's meant to be permanent, yeah. I mean, if there's a problem, someone doesn't like it, we can remove it, but it's meant to stay in forever. If someone loses a lot of weight and then I went in and take it out, they'd be very hungry and gain the weight back because it's working by controlling their hunger.
So, Rachel, I'm sure when you finally said, okay, I got to try something different, you obviously found Dr. Patterson. What was that like for you? What were you hoping to find out, and what did you learn?
Well, I had some things happen prior to that. My brother passed away from weight-related issues with diabetes. My father had struggled with his weight, had surgery as well. And I really wanted to came to a point where I had to do something because I felt like I was going to be at risk of having the same thing happen that happened to my brother.
And Dr. Patterson,
so.
I would assume, because weight loss and diabetes and weight gain and diabetes seem to go hand in hand, this is one way to reverse it, cure it, isn't it?
It is. It could really put diabetes into remission. It's debatable whether it's a real cure, but there was a very good study a few years ago out of Australia proving that the band is better than medical therapy for diabetes. And then just 2 weeks ago, published in the New England Journal, studies showing that our other weight loss procedures that we have in our kind of bariatric surgery toolkit, the sleeve gastrectomy and the gastric bypass, also are much better than medical therapy for diabetes. And so the remission rates to normal blood sugar levels in just 1 year was about 12% for medical therapy and 37 or 42% for the surgery options in just 1 year when they're still losing weight after that. Unbelievable.
Rachel, you lost over 100 pounds. You look great.
Thank you.
What do your friends, what do your family say to you?
I think people who haven't seen me in a long time are pretty surprised. You know, all through my kind of college years, and I was very heavy, and so it's definitely, people are very happy for me and really supportive. It's been a huge life change for me.
You look fantastic.
Thank you.
Is this something that's good for everybody? Is everyone a candidate for this, or?
No, not everybody's a candidate. And so we, the National Institutes of Health has criteria for weight loss surgery where you have to be around 75 or 100 pounds overweight, and the threshold is lowered if you have a medical problem like diabetes or high blood pressure. And then the lap band specifically, since it's a device, is governed by the FDA. The weight requirement is actually a little lower because of new studies that have come out. So about a year ago, the new criteria were body mass index of 30, so just class 1 obesity, or some people only 40 to 50 pounds overweight, but they have to have tried diets and have a medical problem and things like that.
Thank you, Rachel, for coming and sharing your story. I know it's highly personal. If you'd like more information about the different weight loss procedures or procedures that are available to you, check out our website at KH2.com. We'll link you to the Oregon weight loss surgery clinics. Thank you, doctor, for coming in. We appreciate it so much.
Thank you
again,
very
Rachel,
much.
too.
Thank you.
We're back with more AM Northwest right after this. Thank you.